to the course launch of regulatory policies to prevent obesity and diet-related non-communicable diseases. My name is Carmen Gorlick, and I am a nutrition consultant at the Pan American Health Organization. I want to inform you that this webinar has simultaneous interpretation available in English, Spanish, and Portuguese. The interpretation function can be accessed at the bottom of your screen by clicking on the button that says More. From there, you can click on the small globe that says Interpretation and select your preferred language. There also is a question and answer feature available at the bottom of your screen where you can type and submit questions to the speakers and panelists throughout the webinar. To begin, I'd like to invite the Director of the Department of Non-Communicable Diseases and Mental Health at the Pan American Health Organization, Dr. Anselm Hennis, to provide the opening remarks.
Good. Thank you so much, Carmen. Good morning, distinguished ladies and gentlemen, colleagues. It gives me great pleasure to welcome you to the launch of the virtual course, Regulatory Policies to Prevent Obesity and Diet-Related Non-Communicable Diseases. In recent decades, countries in the region of the Americas have been facing an increasing obesity and non-communicable diseases associated with high mortality and morbidity rates. Multiple factors, mainly social and economic determinants, are the major drivers of this rising epidemic of obesity and non-communicable diseases. Therefore, tackling obesity and diet-related NCDs must be recognized first as a societal rather than an individual responsibility, with a focus on creating food environments that make healthy food options available, accessible, and desirable. In 2013, the World Health Assembly endorsed the World Health Organization's Global Action Plan for the Prevention and Control of NCDs 2013 to 2020. This plan has 6 objectives whose implementation at country level supports the attainment of the 9 NCD targets by 2025 and facilitates the realization of Sustainable Development Goal 3, good health and well-being. Part of this plan comprises a menu of policy options that are cost-effective strategies to achieve the WHO goals. Furthermore, in 2014, PAHO member states unanimously approved the Plan of Action for the Prevention of Obesity in Children and Adolescents to halt the growing epidemic of obesity in this age group of the population. This plan recommends using a comprehensive set of policies to transform the current obesogenic environment, which includes regulatory tools to achieve this goal. More recently, and in line with our regional plan, the WHO Acceleration Plan to Stop Obesity presents a package of prioritized interventions to address healthy diets across multiple settings, including comprehensive policies such as the regulation of marketing, labeling, public food procurement, and the school food environment, as well as taxation for unhealthy products. Many countries in the region of the Americas have changed or have been seeking to change norms and adopt policies, actions, laws, and regulations to reduce the demand for and offer processed and ultra-processed products which are harming the diets and health of the population. Despite notable progress in the region, much remains to be done. Laws adopted or which are now in preparation and the regulations to execute them have been challenged by industries opposing effective public health measures, delaying or halting their implementation. As a result, the policy cycle to take laws and regulations into effect needs support to overcome industry interference, along with technical, legal, and political barriers. Therefore, PAHO is implementing this virtual course to advance the World Health Organization's and regional nutritional agendas and to strengthen participants' capacity to advance and support effective regulatory measures that reshape food environments, improve diets, and curb the obesity epidemic. I want to take this opportunity to acknowledge the numerous internal and external experts who have been involved in the development of this evidence-based course, including individuals in academia, public health experts, and representatives of civil society organizations. This collective effort, combined with the invaluable expertise and experience of everyone involved, has contributed to the strength of the final course. Additionally, this course would not have been possible without the financial and technical support from the Global Health Advocacy Incubator. Thank you very much. I wish you all a productive and successful webinar. All the best, and thanks for participating.
Thank you very much, Dr. Hennis, for those introductory remarks. Next, I'd like to invite Rachel Morrison, the Senior Advisor for the Caribbean at the Global Health Advocacy Incubator, to provide context on the need for the development of the course. Okay, it's looking like Rachel is not in the webinar yet, so we'll move on to introducing the moderator of the session, Dr. Fabio da Silva Gomez, who is the Regional Advisor on Nutrition and Physical Activity at the Pan American Health Organization.
Thank you very much, Carmen. Thank you, Dr. Hennis, for your opening remarks, and I really thank everyone for joining this launch of our self-learning virtual course on regulatory policies to prevent obesity and diet-related non-communicable diseases. As Carmen, no, I just wanted to highlight that everyone, if is anyone that just arrived, just joined the webinar, we have simultaneous translation. You can choose by clicking on the globe into the Zoom platform. You can select the language you prefer, English, Spanish, or Portuguese. We also have a question and answer space for you to share your questions as we will address some during the panel, but also you can share them and try to answer them as best and as quickly as we can. So as we know, regions across the world and our region in the Americas have been facing an increasing trend of obesity and diet-related NCDs associated with high mortality and morbidity rates. And this rapid increase has been threatening not only health, but also the well-being and the economies in our region. So it's being recognized that the actions that we need to take, they're not no longer an action. They're focused on individual responsibility, but it's actually a societal issue that needs to be addressed. And that requires us policies that can tackle the food environments and facilitating healthier and reshaping that environment to make healthier food options more easily available, accessible, and desirable. And that's the key motivation of these online courses, and also its purpose to bring a strengthening to the region in terms of their capacity to advance and support effective regulatory policies to reshape the food environment. And this, in particular, focusing on the most cost-effective policies that can drive such reshaping into a food environment that can enable improved diets, prevent and manage obesity and NCDs. So what are the key objectives of this course? So first is really to build the capacity of participants to design and advance regulatory policies, and we'll talk a little bit more in details about which policies we're speaking of. Learn more about the effective ones and how and what makes them more effective. Also learn about the WHO and PAHO regional plans of actions that also bring commitments of countries to adopt those effective, cost-effective policies. It also addresses the understanding of conflicts of interest as an important element of the advancement of regulatory policies, and we'll talk more about that as well. And also, we have one objective, which is to have participants to learn more about WHO and PAHO tools that can help them advancing regulatory policies, being in designing or any element of the policy process, from discussion all the way to policy implementation. So the course is structured in five modules. So one model is on front of pack labeling, the other one SSP taxation, the third one on marketing restrictions and food and non-alcoholic beverages. Then we have also one on food environment, schools and other settings. And finally, a model that is dedicated to the prevention and management of conflicts of interest. And I'm mentioning these four, and in addition, we have a syllabus or an introduction model that brings sort of introduction of the entire course. But really, the core models are five, and they include the four regulatory policies and the prevention and management of conflicts of interest. We designed the course thinking as the key participants and learners to be policymakers, public health professionals, civil society organization, and also PAHO personnel from country sub-regional offices and advocates that are interested in learning and supporting regulatory policies to prevent obesity and diet-related NCDs, including researchers or practitioners that are advocating for a barefoot environment in their country. The course in total, so if we could say by model, the duration of each model is estimated to take 60 to 120 minutes, depending how your pace is in following each of the model. Putting it together, it will round to around 10 hours of course of this for this self-learning course in total. The participants' learning progress will be monitored, so we have evaluations and also a final course evaluation. We have modules evaluation at each module, and also a final course evaluation. And at the end, once the learner has successfully completed all modules and passed the final test, so within 3 attempts, they will receive a certificate from PAHO for completing that. So the course was developed engaging not only the evidence that we have on these policies, but also a lot of expertise from our PAHO team and external collaborators. So it gives, in terms of content, an overview of the regulatory policies, the policy pathways and recommendations that emerge from those, country experiences and relevant and important definitions, for instance, that are important for designing such policies, and also resources and publications that could help them further and deep dive in some of specific questions learners are interested in. And also it adds some key takeaways and informative evaluations that can help build their understanding of certain topics and reflect on some of the important elements of policy design and implementation for these regulatory policies. And of course, in terms of all the research that brings together not only primary, some secondary research we've done or we've collected, put together, including from the great literature, And I also need to acknowledge that this is the result of a 2-year work that's being putting together more than 30 people from PAHO and from our donors and other external collaborators being engaging with us on this work. Yeah, so we could get to this day and offer to the entire region and the entire world. Actually, this is as it's an open self-learning course that we encourage everyone that is advocating to move forward this policy in their countries to take, and we hope will help in advancing such policies. We will now move into, so this is you have also on the chat the link for which you can use to access and register for the course, and we will have more details on how you can register and take the course in the following presentations. But and so that means now we're going to move into more we would like to give some more elements about the course development. It's not only about content, it's also about how it was designed to make it much more user-friendly for those that are taking the course. So I wanted to invite Carla Spinillo, Christopher Hammersmith, and Bolívar Escobar, who are all information design researchers at the Federal University of Paraná, Brazil, to speak about the design of the course that were really thoughtful for us to reach the best we can, the objective we're pursuing.
Obrigada, Fábio, pela apresentação.
Thank you, Fabio, for this introduction. I am very happy to be here. Let me share my screen with you. Let me just check if it's all working.
Pronto. Então, primeiramente, obrigada pela presença de todos e pela...
First of all, thank you for being here. Thank you for this introduction, Fábio. I am Dr. Carla Spinillo. I'm here with Bolívar Escobar and Christopher, and we will talk about the design of the course. We wanted this content to be visualized because it's so important, and we wanted students and everybody who takes the course to have access to information and to content the best way so that they could engage with this course. So I'll start talking about the theoretical approach, and then I'll talk about the design concept used in this course, and then we'll talk about visualizing complex contents through infographics. Let's start with theoretical approach. Our main objective was to make communication easier with those who are taking the course. We worked with content, creating clusters so as to limit the interface information and trying to balance all the elements on this interface so that it could be easier to cognitively process the course. We also wanted to decrease the cognitive overload because these contents are complex and dense in some modules. And one example of this strategy has to do with the references. We had a great number of references for each topic in this course due to the dense content, which was needed because we're discussing public policies. So we tried to find a way to create the basic bibliography, and we created annexes in the course, and we tried to visualize them here with colors. You can see that the colors are used so that the main content could be offered as well as a secondary content, and that could be understood by the student. We also tried to establish strategies to establish a more effective communication in using multimedia, because this is an interactive platform. We try to reduce the extraneous processing. And what is that? If there is unnecessary information, we can have a cognitive overload. Therefore, we try to reduce extraneous processing. We try to manage the main processing that should be for the complex and important content, and we try to create a generative processing. This is necessary so that the student can select, organize, and integrate the knowledge, the important parts of this material, and they have to integrate that with their previous knowledge. So we worked with images, with the interface, and we tried to create this visual appeal to the materials. Here's an example. We have a very dense table here with a lot of information. So we tried to work with this content to create images, and here we can offer details in an interactive way so that the student can engage with the screen, the interface, and therefore take in this dense content. We also established some images, some strategies for images. So we have documents, we have videos, and we also have foods and beverages, and we try to be realistic in this because the course is a course about public policies in this area. And we also have a more abstract side to this because we have processes, concepts, and explanations involved. And we try to create infographics for those. So we are working hybridly with these two concepts. And here's an example. This is the screen. We have pictures of food and beverages, and here we have everything integrated in a hybrid fashion. So you will have the small images and photos. We used varied resources for education. We use videos, podcasts, animations, infographics, and we use this in the modules and also in the assessments. And we use this in the final assessment and also in the formative assessment. Here's an example of the interface. We use the video here. This is the first moment we're explaining the interface of the course itself. And here we're trying to visualize the information, and we're translating complex content and integrating text and image. Here are a few more examples: videos and also pictorial elements. And this has to do with regulation in Chile. And here we have an interactive screen. So we wanted to show you some of the figures. We worked with 6 scripts. We used around 500 visual resources, which include animations, icons, diagrams, maps. And we think that the team worked around 1,800 hours, and the team is formed by the 3 of us. We are researchers and also designers. And now I would like Christopher to talk about the design concept and the visual identity. Thank you. So I would like to talk about the visual aspects for this work. One of the first aspects was defining the typographic style. We defined 2 styles. One would be used for titles and whatever we wanted to highlight, and the other type for the body of the text, and also for information that was not being highlighted. Right here, we used colors instead of bold type because we thought that this would be visually more interesting, more pleasant, and we also chose a palette, so it's mostly gray and blue. And we also added a secondary palette with different colors, with green, yellow, red, and purple, that could broaden the color use for the graphic aspects and the images used in the course. Besides this basic definition, we also used this idea of the tree. This is what creates the visual identity. This is a metaphor that is used a lot in several moments. We have this for the modules, for the contents. It's the tree. And we use this because it symbolizes values and ideas that are aligned with our course, healthy life, connections, and growth. As Carla mentioned, we have these images to support the course because the course is dense. So we didn't want to present the text directly to the student all the time. We wanted the student to be able to access the text gradually, and we used image to create this process. And here are some of the interactive elements that we use to introduce the text. We use flashcards, we use tabs, and this allows the student to gradually get into the text so that they don't receive a very long and dense text right up front. And we also use podcasts and videos and also experts in videos. And now I will ask Bolivar to explain the infographics aspect of the course. Thank you, Christopher. Can you hear me well? I think my mic is working. I'd like to here explain a little bit what our process was, what approach we used in this specific phase of the work that we call transforming the content. During the development, during the development of the content, we often would see information that was complex or very technical, and we thought it was an opportunity to adapt them, to transform them, so that we could have images and diagrams that could be easily seen and visualized. So we created visual resources to support the text. For example, in this specific case, in Module 2, there was a section explaining the Pigouvian taxes and also the taxes for beverages. So we saw that we could create a diagram. So after analyzing the text, we brainstorm and we think, what could we do with this information here? Well, we could create an infographic or maybe an animation. How can we transform this text in something that is visually more interesting for the student in this course? And after a few attempts, after working with some alternatives, we reached this point here. This slide shows this well. So you will see this image with the technical text. It will inform the reader, and it also brings additional information. And it visualizes the concept as well, so it's more accessible. When someone sees this, you start creating a visual narrative, and you can interpret the information in a more effective and in a broader way as well. And here's another case when we already have graphic information in the course, we try to improve it. So on the left, we have this that was in the original context, and we thought, how can we contextualize this information and make this into an interactive element? On the right, you have the result. We have some information that was added to this image, and then the reader, the student, can navigate through the information, the context, and can understand a little bit better why this bar chart is here in this text. So it becomes an element that has a greater educational potential.
I'm also going to conclude my contribution here, and I give back the floor to Carla. Thank you very much, Christopher Bolivar. So to close this presentation about the design, transforming the interface of the course as a mediator between content and participant, we hope that this will bring students and participants a value experience through the interface, the information design, that this interface be useful in terms of topics and resources that are being processed with interactions that are accessible. And because the content is so visible, they are made easier to be found and easier to interact with the course. In other words, a visual appeal that will generate engagement and motivation in order to be interacting with the course. And finally, because this is a PAHO education resource, this concept will have a lot of credibility, and we really hope that our work, this visual design, may reinforce this credibility. In other words, give more credibility to the visualization of this interface. Thank you very much.
Muitíssimo obrigado, Carla, Christopher, Bolívar, pela excelente
Thank you very much, Carla, Christopher, Bolivar, for your excellent presentation. These design elements are so very important for us to be able to translate and make the content more accessible. This is how we are going to convey content. Oftentimes, if you have experience of knowledge, but then you are unable to translate this to the audience, you're going to be closed in your little box and have no access to the learners that you want to reach. So
a lot of people already ask me, how can I register? How this is gonna work? Is it so more about the practicalities of the online course and how it operates within our virtual campus for public health of the Pan American Health Organization. So I'd now like to call on Edgardo de Gracia Tejada from our virtual collaboration and e-learning. He's our virtual collaboration and e-learning specialist for the virtual campus for public health at the Pan American Health Organization. So that he could discuss the implementation of the course material onto virtual campus and how indicate how interested learners can register as well. Thank you very much, Edgardo.
Gracias, Fabio. Buenos días a todos.
Thank you, Fabio, and good morning, everyone. I'm a specialist in virtual collaboration and online learning, e-learning. I've had the privilege of working with the Public Health Virtual Campus over the last 10 years in Panama as a senior engineer. All of the different technologies, I work on the technologies that are behind the scenes. We're going to talk about regulatory policies to prevent non-communicable diseases that have to do with nutrition. This is a very powerful tool that public health policy makers can use, and anyone can use with access to the internet. So I'm very happy to launch this course on the PAHO campus. There are 10,000 people from all over the region who have signed up. We have the potential of reaching 500,000 people. The potential of this to transform public health is incalculable. One of the main advantages of this course is how readily accessible it is. Participants can follow along the course at their own pace. That makes this a very valuable educational resource. Now you can go to the web page, campus.paho.org directly, or you can look up concrete, specific courses using search engines such as Google. Once you are on the web page, you have to create an account if you don't already have one. You have to authenticate yourself. I would encourage you to take a close look at the information on this course before you go in, and once you have filled out all the different activities, you can download an electronic certificate, just like the one you see on the screen. And we stand by to help you should you need it. Our assistant services are always available. So we encourage you to take these courses as soon as possible, and then you can then apply the knowledge that you've learned. And please provide feedback, because that helps us to enhance our courses. And hopefully this will have a lasting effect on the health of the population and on reducing non-communicable diseases, bringing down the cost of medications and improving people's lives. I'm going to give you a brief demonstration of this process. Now, just type in to your search engine campus.paho.org. Once you're on the page, there are two buttons on the right-hand side, upper right-hand side. You can create an account or just log in if you already have an account. If you don't have an account, you can create one. On this page, fill out each one of these fields, username, email address, confirm it, and so forth. Put in the correct information, especially your name and last name, because those are the names that are going to appear on your electronic certificate. Once you've filled this out, you will receive an email You're going to have to verify that you actually own that email. A link will be sent to you. Click on it to verify. Once you've done that, then you can start this session. And then, of course, put in your credentials. That's how you're going to log in, starting your session, and you see that there no longer are the buttons for creating your account or logging in, because you have already logged in and you've already created an account. And you can see the different buttons here. Self-learning is the first option. Click on that. That will give you access to the list of courses available free of charge, self-paced. The first course you see here, click on that. Here you'll find more information about the course, the objectives of the course, the structure, and then if you want to take the course, click here, join session, and then you will have access to it. Let me repeat that step. Join course. We're on the information page for the course. Click on Join Course. That will send you to our educational platform, where once again you are going to be prompted to log in. That gives you access to the educational platform. And here you see in the upper left, enroll me in this course. Down below, it also gives you the option to enroll. You click on either one of the two links, enroll me in this course. Once you've done that, You will not have access to the course. You'll see the different links, hyperlinks to the different modules. This is just to test the entrance test, and you can see important information that explains how this entrance test works, how you should start by doing that, and then next you'll have access to the different modules. Module 3. Again, if you want to go into Module 3, after clicking on it, this menu opens up. You have to do the entrance test again, and you can navigate from module to module, and this here will tell you what you've completed, what you have yet to complete. And in order for you to move on to the final evaluation, you have to have first completed all of the different modules. And then you will have access to that final evaluation, and ultimately, once you've done everything, you will receive your certificate of participation. That's it. And on behalf of everyone from the virtual campus and Pan American Health Organization, I wish you the best of success in this course, and I hope you learn a lot. Thank you, Edgardo.
Really, I think very clear presentation on how anyone could register and take the course, and how also they can not only benefit from it, but share and make that the benefit shareable to the entire society. So I think with that, we're now moving to our next panel, which is intended to bring the views of experts from government, from academia, from civil society, and trying to understand the relevance of these policies and such course, and how it could help advancing the work that we need to achieve in adopting and implementing these policies to improve diets and prevent obesity and NCDs. So now I'll introduce the entire panel, and after that I'll introduce a series of that we agree to discuss here. So everyone, as I call, we can all bring your cameras on, so we can have the entire panel engaged. And I'll start thanking so much for Dr. Simone Spence, Director of Health Promotion and Protection at the Ministry of Health and Wellness in Jamaica, for making the time to be with us. It's really, really much appreciated your presence today. Dr. Arantxa Colchero, health economist and researcher at the National Institute of Public Health of Mexico. We also have with us Dr. Lorena Rodriguez-Sosiak. She's Associate Professor and Director of the School of Public Health in the Faculty of Medicine at the University of Chile. Nicole Foster is the law lecturer and head of the Law and Health Research Unit in the Faculty of Law at the University of the West Indies. Welcome. Thank you for being with us today, Nicole. Dr. Gaston Ares, an associate professor in sensometrics and consumer science at the University of the Republic in Uruguay. Thank you very much, Gaston, for coming. Dr. Maisha Hutton, Executive Director of the Healthy Caribbean Coalition. Thank you very much, Maisha. And Dr. Champagne, Executive Director of the Healthy Americas Coalition, also representing this important coalition of civil societies moving these policies forward in our region. So I really wanted to thank you all for joining, and as a first round of discussions, I really wanted for everyone to hear what has been your experience in advancing or in supporting these regulatory measures, including the front of pack labeling, SSB taxation, marketing restrictions, school regulations, and the prevention and management of conflicts of interest that are being highlighted in this course. And what are the capacity, what are the challenges and the capacity challenges you identified to advance these measures in your country or in the region of the Americas? And if I could start with Dr. Simone Spence, would love to hear your thoughts on that. Thank you very much.
Good morning, everyone. I'm hoping everyone can hear me clearly.
Perfectly, thank you.
Okay, great. Chairperson, distinguished guests, ladies and gentlemen, good morning. It is my distinct honor and privilege to be representing the Minister of Health and Wellness, Jamaica, Dr. the Honorable Christopher Tufton, who is unavoidably absent. Permit me to offer his apologies, as unfortunately he was involved in an accident on the weekend, but he's stable and doing well and is expected to make a full recovery. He sends his best wishes for this very important launch and asks that this statement be delivered on his behalf. The government of Jamaica, through the Ministry of Health and Wellness, welcomes the launch of this self-learning virtual course. This course, among other things, will advance the World Health Organization, Pan-American Health Organization's nutrition agenda, with special focus on the regulatory policies that can help curb the rise in obesity and diet-related non-communicable diseases. Jamaica's public health sector, like other countries in the region and indeed around the world, is facing the increasing challenge of addressing NCDs. The most recent Jamaica Health and Lifestyle Survey reveals that 1 in 3 Jamaicans has hypertension, 1 in 2 is overweight or obese, and 1 in 8 has diabetes. And this is telling us in no uncertain terms that Jamaica, like the rest of the world, has an NCDs crisis. Additionally, with high mortality due to NCDs and an aging population, our country is at a risk of experiencing high costs to provide healthcare services and a significant increase in potential years of life lost. In 2020, deaths from NCDs resulted in the loss of 144,853 years of potential life, marking a 30% increase in potential years of life lost compared to the previous year. And this equates to an additional 33,775 years lost annually over a decade. The rate of increase in potential years of life lost due to NCDs surpassed that of all causes, with NCDs showing a 30% rise compared to a 19% increase for all causes. On an individual level, the household burden of NCDs has pushed a significant number of people globally into poverty. It has also affected labor productivity and the earning and saving potential of many Jamaicans. It is well known that a healthier population and greater longevity can lead to increases in our national saving rates. Healthy people have a greater incentive and the potential to save. The East Asian economic success has been partly attributed to this critical factor. What all of this means is that as a matter of urgency, the government of Jamaica, through the Ministry of Health and Wellness, must drive the NCDs agenda forward. We have to design plans and implementation strategies that make behavioral science a central focus. While NCDs can be prevented by adopting healthy lifestyle habits such as eating healthier foods, increasing physical activity, avoiding excess alcohol, and not smoking, among other lifestyle changes, the government has the responsibility to create the regulatory framework and enabling environment to support the healthier lifestyle choices of our population. This again underscores the significance of this course and the ability for policymakers and others to benefit from its content at one's own pace. In the government's attempt to address premature mortality caused by NCDs, the Ministry of Health and Wellness is adopting a life-stage approach to health promotion and prevention to impact personal and collective health care. From as early as conception, the expectant mother and child must be given guidance around healthy practices for pre- and postnatal care. Through the various stages of growth and development, the health system must facilitate persons making informed choices about their health, starting in primary care to support lifestyle practices to avoid or reduce premature mortality and improve the health outcome of each citizen. This is all captured in our National Vision 2030, but for us in public health, it has implications for how we structure our health system. In this life stage approach, it is critical to deliver messages around the life stage to people where they are. Therefore, community interventions are critical. Taking healthcare services to the people is necessary to guide behavior and support healthy lifestyle practices for the very early stages of development. This is particularly more important as our disease profile is populated with preventable illnesses and premature death. I laud and thank the Pan American Health Organization for its continued partnership and look forward to our continued collaboration together with our other stakeholders and anticipate the benefits from this course in the interest of public health. Thank you. And so that was Minister Tufton's message to the team today, talking about our Jamaican experience in a particular context. But, you know, understanding that we all have this problem that we need to address by utilizing different policies and strategies, targeting different level of policymakers if it is that we intend to have an impact in terms of curtailing our NCD crisis as it exists. So thank you very much, Chair. Over to you.
Thank you very much, Dr. Spence. And I think this makes so clear how important it is to have the systemic approach and the need for that we clearly see from our member states, from our countries, to advance those not as isolated actions, but something that comes as a package to support decisions that can, you know, individuals on their own cannot make by themselves. So we really need to get them in place to have an effective impact. So you know, I'll invite now Dr. Arancha Colchero to also bring her perspective and some of her experience from the academia, but also from the research that's also supporting policy in a very applied way, let's say.
Thank you, Fabio. Thanks for inviting me. It's an honor to be here. So in terms of the experience Mexico has, the country has implemented most of the structural interventions that will be covered in the course with differential levels of effectiveness, and not all of them have been evaluated. So we have regulation of food and beverages in schools, marketing restrictions to food and unhealthy food and beverages, and we have front of pack labeling and sugar sweetened beverages and food taxes. And so as academia, I work at the National Institute of Public Health. What we did for the implementation is we gather some context analysis in terms of the consumption of added sugar in the country, the prevalence of non-communicable diseases. We gather information from meta-analysis on the risk of consuming SSBs. We also, from an economic perspective, we worked on the feasibility of implementing SSB taxes by estimating price elasticity, looking at potential substitutions, and from there, looking at potential reductions in consumption and estimating revenues. So we had a lot of interactions, and that's something that happened in Mexico between academia, advocacy groups, and lobbying groups. So that was a strength. And we also had the opportunity to do extensive impact evaluations for the taxes, on prices, on sales, purchases of tax and tax beverages, on the impact on employment, because the industry always says that there would be a negative impact on employment. There wasn't. we had the opportunity to look at the impact on dental health, and there's been a lot of modeling on healthcare benefits. In terms of the challenge in Mexico, so one of the challenges is that we have a very low tax in terms of SSB. In terms of what it represents of price, it's just 6%, and still SSBs are very affordable. And our big challenge was that during this, the current government taxes couldn't be increased. Only there was an adjustment to inflation. So very quickly, challenges in the region, maybe less than before, because now there are 21 countries that have implemented taxes, over 33 in the region. I think implementing and building a proposal, it's easier now. Some countries can claim that they don't have their own data, but there's a lot of data around now, meta-analysis of impact evaluation of SSBs. I think there's a lot to build with information from other countries. Not necessarily you would need to get your own data in all the phases. And I think there's also always the need to have support from the government, either Ministry of Health or Ministry of Finance, always trying to counteract industry arguments. There's a lot of experience in the world right now. And I think it's key to have the ability to conduct impact evaluations. It is sometimes a challenge if data is not available, but if countries can, it is important to conduct impact evaluations. Thank you, Fabio.
Thank you, Arantxa. I think it's very clear, and I think one of the things we try to do with the course as well is link the need for research, the link for evidence, the need for evidence, but also try to bring to participants as much as we can what we already know, and do not require, as you clearly mentioned, additional evidence, because evidence is there's some evidence that is needed and will help the process, but sometimes if there's something that is clear already for all countries, this will save many countries from delaying the advancement of action. So I think it's very good, the point of being very clear of what is needed and what is already done, and enough to move forward in certain aspects of these regulations. As we continue to the panel, me gustaría invitar ahora a Lorena Rodríguez Osiak.
Lorena Rodriguez, please, if you could just tell us about this process of thinking through the different policies and how that entails tackling or facing the counter arguments on the part of industry that wants to keep the market unregulated. So I leave that open to you, just to tell us about your experience about your regulatory policies, not that is as a whole system of policies, as has been done in Chile.
Thank you, Fabio. Thank you for this invitation also to this very interesting session of the launching of the course for the regulatory aspects. I have to say that today I'm in the academic world. I head the public health school in the University of Chile, but the experience I'm going to talk to you about is from some 15 years ago, working in the health ministry in public health policies, mainly structural, regulatory and legislative, which I think may contribute to underscore what you're trying to present with this course. At the time, I had to be part of the health ministry in the design as well as the implementation process of what in Chile is known as the labeling and food advertising law, which dealt with three key aspects in general. First, it was the nutritional warning label. Second, the implementation of advertising restrictions, mainly directed to children, and restrictions that would offer a healthier school environment. At the time also, and this was all at the same time, and we had to implement taxes to the sugared beverages. Taking into consideration the food situation, the nutrition situation, and the chronic non-communicable diseases and diet-related in Chile, the basis seemed very obvious for us to go with these policies. I have to tell you, this was over 10 years ago. And the topic was not as present as it is today. So despite our having very alarming figures, and they continue to be so because they've dropped very slowly, there was a lot of resistance to implementing these structural or regulatory types of policies, which meant that we had to work to find the technical and epidemiologic and public health aspects based on very scarce evidence that we had at the time about the need to implement these policies and to develop a document which we call the arguments and the foundations so that we could respond to all the questions and all the concerns that were expressed from different sectors. I have to say that the fight was not just against the industry. Of course, they strongly opposed the regulations, but there were other sectors as well in, for example, the academic field, who really felt that we had to continue with the traditional promotion of healthy life and not the regulatory or other aspects. This was a very difficult fight at the time. After implementing the law, our next job was very difficult, which was to implement it, to actually regulate it with guidelines and the standards so that the law could become effective and not just remain on the paper. What we had to do then was to resort to a series of definitions and details. Of course, when you say the frontal warning label, period, you have to figure out what are you referring to? What type of labeling? What are the limits of the critical nutrients? What are the critical nutrients? What's the sphere of application of the law? For example, in advertising and media, it's going to affect. So there was a whole series of definitions required, which were not easy to establish and which would, in the end, allow for the actual implementation of the law and its regulations. And it also allowed us to supervise, monitor, and evaluate. That led to many different challenges. I'm going to mention them in general because I don't want to take up too much of your time. But the first thing was that we had to have technical preparation to defend and explain why the regulations were necessary, why to regulate in that area specifically, and why using these spheres of application that we were using for the law and its regulations. After that, we also required training legally and regulatory so that the law and the regulations would not clash against other laws or other regulations and not being able to implement because of that. We also had to prepare in policy management fields. We mapped the different actors that were in favor and those who were against, and we analyzed the arguments of each one of these actors so that the discourse could be appropriate, adapted to the different arguments. We couldn't just have a uniform discourse because the arguments were different. And we needed to remove ourselves from that position of just health and adapt to the economic aspects, the labor aspects, the people that were working in that field, academic arguments, social arguments, marketing aspects. So there was a series of aspects that we had to adapt to. And if you want, I can share with you all the information that we have. We also trained in a common story, regardless of the fact that we needed specific arguments for each aspect. We had to have something that was common to all those of us who were defending the process, so that we not find ourselves mistakenly understood with certain sentences that could be used against us in the end, because this one said this and the other one said the other. So we had a basic argument. We had a group of work in the health ministry who partnered with some of the parliamentarians and some of the academicians and had this uniform discourse with adequate arguments for each counter argument. I must add also that in Chile at the time, the lobbying law was already implemented. And this lobbying law helped us have formal, transparent meetings with all sectors. We didn't reject any meeting. If they asked, they were opposing us, we accepted a meeting with them. Those in favor, we accepted them. All those meetings were public meetings with minutes signed by all the participants, with all the agreements reached. Anyone had access to them. In this way, we were able to order this lobbying, the industry lobbying in particular, but also it made it very transparent, showing exactly who was in favor and who was against, because those positions are not always that obvious. When it's the industry, it's obvious. But when there are some academicians or other sectors, even some social sectors that were against, that was not as clear. If it was not shown clearly, then the conversation becomes a little more complicated. And I must confess that the lobbying law was very helpful, very, very helpful for us to be as transparent as possible with all the conditions, all the conversations, and all the positions. And then we had to train in communication. We had a lot of information from the media, the mass media, both against and in favor, which confused the population somewhat. So, as I said before, we developed a story. We had a common text. And at the end, I want to say that the partnerships we established at the time with the UN agencies, for example, and PAHO and FAO and UNICEF, all these partnerships that were established with some of the academic sectors that were in favor, and the partnerships in Chile, for example, with the parliamentarian group, plus the executive branch, in this case, the health ministry, were helpful to build that cohesive working group that was constantly coordinating its work to respond to the demand of the implementation of a regulation, which at the time was a real innovation. And people were really resistant. It's not as innovative today. However, there's a lot of resistance still. And I think that that experience helped us develop a set of informative aspects that we offer with pleasure to all those who may be interested or may need it. And this was very helpful for us to advance and succeed in the implementation of a law as complex as the one I'm telling you about. And each one of the modules of this course, in fact, take each one of those axes into consideration perfectly. So I honestly believe that this is going to be a tremendous contribution. Thank you very much. Thank you very much, Lorena. And I really believe that that is related to the need to not just connect science with the different actors, and not only government actors, but all actors of the government that have authority over these public policies, like the taxes, for example, and the need to have people who can support the political processes, which, as you said, was like a marathon and not a sprint. And with that, I'd like to now give the floor to Junie Cole Foster.
Her experience and her thoughts on advancing these policies. Thank you very much, Nicole.
Thanks, Fabio. And in the interest of time, I'm going to go keep my comments brief to the 3 to 4 minutes. So I chose 2 of the 4 policies to sort of focus my comments on. And those are the policies relating to front-of-pack warning labels, as well as regulation of marketing in school environments. And in terms of our experience to date, or our engagement. So we've been deeply engaged on both of these issues for several years now at an advocacy level, but we have only been able to get limited success to date in terms of certainly in Barbados, I'm speaking about, in terms of implementation of school nutrition policy. The front-of-pack warning labels we had addressed at the level of the regional level, and that became stalemated largely due to industry interference and the lack of the necessary political will to basically push back against that in a way that would have delivered public health outcomes that were supportive of the overall goal that we had engaged in, that we were pushing. In terms of the experience with implementation or even engaging on these issues, I would say, our experience has been to reinforce the importance of implementation and monitoring. So in the context of the school nutrition policy, a big challenge we have is implementation and enforcement of the regulations within the school environment, creating those buffers outside the immediate environs of the school, getting people to really understand and buy into why it is important to regulate the school in this way. Many parents are still, not quite getting it, and thinking, well, we could have a little bait sale here, we could sell some lollies here, we need the money. And that's the other challenge as well, even in the context of dealing with things like industry interference, which was seen very clearly in the context of our front-of-pack warning label experience. One of the big challenges we have in terms of trying to pull back from industry and try to get governments and other players as well, to be fair, to keep them at arm's length, even as we involve them and get their input as stakeholders, is, the almighty dollar. I mean, many of our schools, many of our wider programs, etc., are under-resourced. And therefore, if we have industry, albeit, it's big food, or coming to the table and saying, well, we'll pay for this or we'll sponsor that, etc., it becomes very, very challenging for persons to say no for a very real need for something that is worthwhile. And so I would say for me, those have been the main points of chat, and also to the form in which the regulation of the environment takes. So Barbados has gone the route of a policy, and necessarily, therefore, we don't have the full force of the law behind it, because the policy then doesn't quite operate like a piece of legislation, like how we have in Mexico, like how we have in Uruguay, like how we have in Chile. And so that presents its own challenges in terms of the ministry being able to really very strongly come down and regulate the environment in the way in which one would want to see it. And so it becomes very much moral arguments, persuasive, try and get people to do the right thing, as opposed to really having that full power of the law. So I would say, those are my main takeaways that I would like people to have: the importance of implementation and planning for that implementation well in advance of rolling out the policy, to make sure that the things are in place to allow for proper implementation, to make sure the resources are there for enforcement, identify alternative sources of funding, because industry will always be able to catch you with that, because they have very deep pockets, and then also pay particular attention to the format that you use, for the legal format that you use in terms of regulation, because legislation is always necessarily more powerful than just a policy. Over.
Thank you very much, Nicole. And I think you addressed a very important point that, when we try to move structural policies, we need to change existing structures and existing structural legislation to make them operational for the implementation. And I think that I just wanted to highlight that this is something that we do cover on the course when going into each of these policies. We're not just looking into how you design them or the specifics of those policies, but also considerations on how to get them implemented. Looking ahead, is there something that in your particular country you need to be looking after? So right now, I'll hand over to Professor Gaston Ares, who could also, if you could also share a bit of your experience and challenges from an academia, applied research, supporting governments as well in pursuing these measures. Thank you.
Muchas gracias, Fabio, y muchas gracias por la invitación.
Thank you, Fabio. Thank you for the invitation. I also want to be very brief because of the time element, because my colleagues who've spoken before have already analyzed many of the challenges that we often find. In my case, I work in academia trying to generate evidence to contribute to the design and implementation and evaluation of these public policies. And in our experience of working or interacting with the different working groups in Uruguay as well as in other countries in the region, I believe that one of the things that we usually note is that we have to consider what are the best practices, where should we go in a way with these policies, but often the progress attained in the countries is slow. If we see in Latin America, there are many policies where the implementation is far below what's expected, considering the evidence we have currently. So I think that there are many challenges dealing with the training in the one hand, and I think that the course will be a tremendous contribution, and the interdisciplinary view of these problems. Though we are trying to deal with public health problems that are often approached from the point of view of public health and nutrition. Often we don't have the necessary training to understand all these aspects that are involved. And when we play with all these regulatory policies, Lorena mentioned some of the challenges and spoke of the need to add aspects that have to do with the economic aspects or the legal aspects or international treaties signed by the countries. We know there was a lot of influence from the investment treaties in Uruguay. We have a lot of things at stake every time we try to advance with a regulation like this. And that's why when we try to include all these aspects in the regulatory policies is important. And there's a need for us to consider everything that's at stake when we work with these regulatory policies. And on the other hand, I believe that another challenge has to do with the lack of, let's say, resources that can summarize the accumulated experience of the countries. Lorena also brought up the idea of what Chile did, how they advanced, and the experience. And when in other countries we try to find out all these things that have been done, we can't find it anywhere. There's a lot of things with the evidence. The evidence seems to be spread out here, there, and everywhere. There are some reviews, sometimes maybe too many, and sometimes reaching too many conclusions. So I think that it would be ideal if we could have centralized resources. I think that would be very important, a place where we could find the responses that other countries gave to the industry. What are the arguments that other countries have used? Because they're always the same, they're repeated. So there's a lot of things that we can learn from the region and internationally that we don't have centralized enough. I think that that's a challenge for us. Not only the structural challenges that the countries have, which have to do with the lack of resources, the human resources, economic resources, the lack of infrastructure to supervise the policies, but The capacity issue, I think, is something that we could try to work on to achieve a simple access to some of these resources that could be somehow centralized to summarize the accumulated experiences of the region. And I think that this would be an ideal thing that could help the region advance in this field. Thank you. Thank you so much, Gaston. I believe you somehow summarize our limited attempt of how much we can do with a course, but our efforts are precisely trying to, as you mentioned, this accumulation of experiences that you all have. And this launching, I believe, will not only give us access to this new resource, it will also give us a chance to communicate with some of you and see how rich the experience is. And of course, we're never going to be able to reproduce it in the 12 years of history or a decade in just 10 hours, but at least we have tried to speak of the key elements that we believe could help to advance with these policies, and hopefully we will make it.
Ask Maisha Hutton to share her perspective on and her experience and the challenges being facing in terms of the advancement of these policies. Thank you very much, Maisha.
Thank you, Fabio, and thanks for inviting us to be part of this launch. Civil society has been working in the Caribbean, certainly for quite some time now, to try and advance these policies. And unlike Latin America and the Caribbean, we're not as far ahead in the Caribbean. But this tool really outlines a lot of the policies that we've been advocating for, in particular the octagonal front of package warning label, the taxation on sugar-sweetened beverages, and as well as school settings. And just to share a bit about some of the experience and not to overlap with Nicole, but one of the big areas we've been working on over the past 5 years is around the front of package warning label, and that's around introducing a standard. And we've really had some difficulties around with industry interference, as well as with the octagonal warning label advocacy really revealed the kind of weaknesses we have in governance across the region, and the weaknesses and how that opened it up to industry interference. Also highlighted issues around evidence and who curates evidence and what is evidence that's free of conflict of interest, and really starting that debate in the region, because we had to deal with a lot of evidence that came from diverse sources and in fact sometimes from industry. Around with taxation of sugar-sweetened beverages, we've done some advocacy in Barbados around increasing the tax from 10% to 20%. Some of our colleagues in other countries have been also advocating for taxation as well. We haven't had as much traction around the taxation front, but it's an area that's a work in progress. I think where we've seen the most success is around school policies. So regulation of the sale and marketing of ultra-processed products generally is what we've been advocating for, but we've seen progress around sugar-sweetened beverages, and Nicole touched on some experiences we've had in Barbados, but there's been progress in a number of the countries, including Jamaica. What we're dealing with now is challenges around how do you identify the foods that need to be regulated. So in the absence of a front of package warning label, what are the challenges that we're seeing so much administrative time taking up identifying those foods? But we've had real success with civil society working hand in hand with governments to support that implementation. A big chunk of our work, which we've done in partnership with PAHO, while pushing for the policy implementation, has been around developing tools to help to manage conflicts of interest and prevent undue influence. And really trying to tailor those tools and the capacity building to respond to the unique kind of constraints of small communities. And so that's been an area that we've been working on for quite some time. I'd say from a civil society perspective, the challenges that we've experienced and the question was really around capacity challenges, have been around at the national level, building the capacity of civil society organizations to support that advocacy, both nationally and regionally. And so, that's technical capacity, understanding some of these very complex policies. How do we structure taxes for net importing countries? What does FOPL implementation look like in small jurisdictions? And so, some of these kind of more technical concepts have been a real challenge, and it takes considerable resources, both in terms of time and personnel. I can't, count how many times we've called in Nicole to fill this legal gap over and over again because of the dearth of skills in the region, and also the time required to build the capacity of civil society organizations. Also, and this was touched on by another panelist, countering myths. How do we counter some of the industry myths that we're seeing, and having those arguments in one central place, and arguments not only within the region, but from across the kind of broader landscape, so that we can learn, the kind of counter arguments we need to deploy. Case studies are extremely useful. I mean, learning from Latin America in particular, in the experience with Barbados in implementing their school nutrition policy, they determined to include artificial sweeteners because of experiences in Mexico. So it was directly helpful. So those case studies that are outlined in the tool are really helpful for us. I think local evidence has also been a challenge. And then understanding kind of the related concepts around these policies, such as human rights and equity, that's also been a technical capacity challenge. And I'll stop there.
Thank you very much. Thank you very much, Maisha. I think this highlights how much it is important for us to have these tools to build the capacity of those that are advocating for the policies, besides the ones that are to implement and adopt and finally approve the design of the policies. Otherwise, this won't move forward. So I think you are very clear on the need and the relevance for civil society organizations as well. So we'll close this round of comments with Beatriz Champagne. And si pudieras comentar, Beatriz, su experiencia.
Beatriz, could you tell us about your experience and the gaps that you think we have to complete vis-a-vis the training that we have in the region to advance on these issues? Yes, Fabio, thank you very much. First, I'd like to say that I'd like to congratulate you all for the work done, not only by PAHO, but by all those who participated in the design of this course, because I think that it's really very good, very easy to understand, quite appropriate. And I think that that's precisely what we need in the region. CLASS, which is the organization I represent, the Coalition of Healthy America, developed a regional agenda 2030. And in that agenda, they focus first on policies and then on the prevention of obesity, which is one of our priorities. As for the experience, I could say that we have experience practically with all measures related to obesity prevention. Sometimes more, like we're doing now with the countries of Central America, Ecuador, Bolivia, and other countries. And sometimes just as support maybe at a critical moment, maybe by convening some civil society entities that might need to think of a strategy supporting the progress. I think that we have a region with many benefits, taking advantage of the work done by PAHO and civil society. What I find sometimes is a lack of equity between the countries that have a lot of resources to progress, and I see those as countries that need less from us regarding the policy explanations and so forth. But I see other countries, many other countries, that need a lot more than what they are actually receiving at this time. So I think this course is going to be particularly useful for those countries that are currently just learning to advance with these policies and learning to speak to governments and how to have political influence.
Now, I think that this course has precisely the right policy elements with excellent modules, one on conflict of interest. That's great. That is the #1 challenge we face throughout the region, the topic of conflict of interest. That is the industry interference, meddling. So that module on conflict of interest is very clear. It's very to the point, precise. It's quite simple, given how complex this topic is. Obviously, there are many aspects. That is when civil society mobilizes to change a policy, and this course provides the necessary tools useful for government, academic sector, civil society, even international agencies. Now, from civil society, we have to complement this course with information on how to do political advocacy, how to get buy-in, all of which is very important to bring about change. Something I would like to mention by way of a challenge is that many of the organizations in the countries that are most vulnerable, who have the least resources, I always think of a soccer game. We can't all be goalies, we can't all be on defense. We all have to be clear about what our roles are. The role of a government is different from the role of academia or of civil society or international agencies. I think that this course helps us understand all of the different elements of all the different players in the field, so to speak, in galvanizing policies. We are part of a community of practice to promote healthy, sustainable eating habits, and within Colanza, we're working on how to make our argument to industry, seeking out case studies, offering training. I think there is a complementary role here between this course being launched right now and other courses underway or different activities carried out throughout the region that can contribute to expanding people's knowledge throughout the region. Thank you very much, Beatriz. I think you raised some very valid, germane topics. A number of people have spoken about the importance of having coalitions, bringing together multiple voices, and starting from a common understanding, a baseline of understanding, and to bring together all these different voices so that speaking together as one, we can bring about policy change. And there's always going to be a pushback by certain players, and also the other skill sets we have to have that we're not necessarily talking about here in this course, but other needs. For the different actors, that is the training that's necessary to endow all of the different actors in this process to with the necessary tools and skills to forge ahead in this effort. I think you've already answered the second question about how this course can offer the support within the realm of the work we all do. Perhaps if we just go around the table and hear each one of the speakers who could speak perhaps for a minute about how useful this course is for the work that you currently carry out in your country, in the organizations where you work or the academic sector, how this can be used and how this the subject matter presented in this course assists you in the work you already do. If you could just sum this up briefly in a minute. Nicole.
Thanks, Savio. Yes, very quickly. So definitely the course will be useful from sort of wearing the academic hat, head of law and health research unit, and teacher within the law faculty. We, of course, we offer a global health law course at our undergraduate level and our graduate level, part of which includes a module on NCDs and the law. And this is perfectly aligned with that and excellent resources and the infographics and all of those great things and the centralization of information. So I think both at our undergraduate and graduate level, as well as 2 short courses that the Law and Health Research Unit does, this will be a very useful sort of go-to point, a starting point to complement much of what we're doing, and an easy reference point for students. I also like, in particular, in terms of now wearing my advocacy hat as policy advisor with Healthy Caribbean Coalition, I like the summary takeaways at the end of each section. I think that's very helpful. And in particular, with our particular focus right now on conflict of interest, as Maisha was saying, I found it very useful the way how the whole discussion of conflict of interest was broken down in a very concrete way and doing the structural and individual. So really helping people understand the complexity of these issues. And I think that's so key for advocates, because oftentimes they don't fully understand the conflict of interest and how it can play out. You know, so something that seems straightforward to them, they now would realize it's not that straightforward. So I think at both levels, at academic, but also advocacy, it will be very useful.
Thank you very much, Nicole. Shall we move to Arantxa now?
Yes, sure. Thanks. I think that presenting all the structural possibilities in intervention and emphasizing that not a single one would make the difference, or the most interventions that you can implement is useful. And even thinking about aligning them, Chile did that, and I think alignment of these interventions is possible, and they make them stronger. I think it's a very good course because it provides a lot of information that we didn't have before, and that's a way to build a strong proposal because there's a lot of information around, including counteracting industry arguments. And I think for taxation is the ability to have information from other countries, because you have to compare yourself with other countries to see if your taxes are high or low, and there are tools to look at that, to measure that. The designs, it's very interesting how many designs we have now, volumetric, to sugar content that can incentivize reformulation and get more benefits, inflation adjustment, thinking about affordability, not only evaluating the impact on consumption, on health, but also on affordability, looking maybe at adjusting for economic growth, because that happens if income increases, then there's a problem with affordability. So I think this is a very good course that emphasizes the need of structural interventions and not individual interventions that are of low efficacy. Thank you.
Thank you very much, Arantxa. Eu invitaria ahora a Lorena, se pudiera hacer sus comentarios.
Perhaps Lorena would like to comment. Thank you very much. Yes, I think part of what I was going to say I've already said, but I would just say that this course is useful for different sectors. It is important for there to be an intersectoral participatory process to bring about political change. Now, this is a course that's tailor-made and perfect for public policymakers, for monitoring, for oversight. The academic world could make use of this for the purpose of research and also for postgraduate students. Civil society can use this to enhance their organizational efforts and to have this all be in one place, one-stop shopping. Information that until now has been quite scattered, dispersed. So I commend you for this course, and I hope it's quite successful. Thank you, Lorena.
May I invite you, Maisha, to share your comments on?
Thank you, Fabio. I think from a content perspective, everything's been said. The content is beautifully presented. It's so user-friendly. I think it's going to appeal to civil society organizations and civil society organizations at different levels and different stages of their own development. I think also the focus of the course content is a real powerful signal that addressing unhealthy diets requires a policy and regulatory focus. And I think the fact that the conflict of interest is extracted as its own module also sends a really powerful signal that we need to address conflicts of interest. I think moving forward, we now need to think of promotion, right? And what's the role of us as partners in helping PAHO to promote this tool as best as possible so that we get as wide and broadest uptake? And how do we be innovative in driving that uptake? And then finally, I think there's a kind of a whole ecosystem out there of tools and publications that really do support this agenda. And how does PAHO plan to situate this tool within that ecosystem and perhaps point users to other really useful resources that are out there?
Thank you very much, Maisha. So I'll end with Gaston. Beatriz, I think you already covered that as well.
Excelente.
Adelante, Gaston, gracias.
Gracias, Fabio. Bien, creo que la contribución mayor del curso tiene que ver con...
I think the greatest contribution that this course offers is to bring everything together in one course, the different tools, evidence, the learning, what we need to know about designing policies. Again, to bring together different tools that would enable us to deal with conflict of interest, which, as has been said, is one of the biggest challenges we face.
Yo fui el único que desapareció. ¿Me escuchas?
Am I the only one for whom Gaston disappeared? Can you hear me? I apologize. Technical glitch.
¿Me escuchas?
Can you hear me now?
Okay. Bueno, muchísimas gracias, Gaston.
Thank you, Gaston.
Bueno, porque también una de los elementos que hemos tratado de buscar.
Now, one of the things that we have sought to imbue this course with was, in addition to the different target audiences, academic sector, civil society, governments, and so forth, we're also interested in this course reaching and being used by country offices, regional offices. Our counterpart organizations oftentimes have a very busy, full agenda, from matters relating to the pandemic, enhancing nutritional material and programs, and so to have a course that's so well thought out and put together, something that we can share. And I think this course could serve to enhance the training efforts of the full staff of PAHO teaching them how to better respond to countries' needs in the most effective way. I would like to invite Rachel Morrison.
This will make it easier. So I really like to welcome Rachel Morrison from the Global Health Advocacy Incubator, which has been our donor supporting this activity, not only financially, but with a lot of technical support as well. And really in thanking the Global Health Advocacy Incubator for its support. Welcome, Rachel, to share your remarks on the experience of Global Health Advocacy Incubator work and the value of this course we're launching today. Thank you very much, Rachel.
Thank you very much, Fabio. And I apologize, my video has not been working. It doesn't seem like that's working. It's been a challenge today to be able to join you all, but I'm really, really glad that technology has at least enabled me to sit down and listen to the sessions. And hopefully I'll be able to continue and you all can hear me. And, as I bring these brief remarks from the Global Health Advocacy Incubator. The Global Health Advocacy Incubator and PAHO have actually been partnering in addressing obesity and diet-related NCDs for almost a decade now. Can you imagine? Time flies when you're having fun. We have, of course, collaborated on numerous meetings, workshops, webinars, and reports, and a lot of the presenters have alluded to the partnership work with PAHO on a lot of the policy areas that are the foundation for the course. During this time, both organizations have witnessed the evolution of NCD diet-related advocacy, and with that, the growing importance of developing regulatory frameworks that can support the reduction of diet-related lifestyle diseases. What we noticed is the continued call by governments for evidence to support the development of policies and legislation. The best way to continuously provide this evidence is by ensuring that all the critical stakeholders in the policymaking process have access to it. This includes ministry officials, technocrats, PAHO, in-country and regional focal points, academia, health advocates, and other CSO representatives, all of whom play a different role in the policy development process. And this is what this course is able to do, provide the evidence to these key stakeholders. The incubator works very closely with CSO partners, and over time, we've been very impressed with their dynamism, flexibility, how they can react rapidly to challenges, but also their ability to convene CSOs, support government with technical expertise, and how they're able to publicly speak out against food and beverage industry interference in policymaking. CSOs provide a critical voice for sharing evidence grounded in good science. For us, this was the genesis of the development of this self-paced learning course to further provide capacity strengthening opportunities for our CSO partners and our internal teams. It being developed by PAHO was a guarantee that the course would be grounded in scientific evidence that could support policy development processes. And of course, PAHO naturally tapped into their resources, knowledge, and expertise, and the results are impressive. We tried to play our small part as well in the collaboration, but naturally, the majority of the work was done by PAHO. The success of other courses on the PAHO virtual campus has been about the flexibility, right? The flexibility for the users, the user friendliness, and this is, of course, an asset for CSOs, right? And I'm grateful that everyone has had an opportunity this morning to go through and have a look and see just how easily the content is being presented on some very, very complex issues. For us, as the Global Health Advocacy Incubator, we'll be continuing to expand our work in the Asia, Pacific, and Africa regions. And our advocates, internal teams, and CSO partners will be able to use the self-paced course to acquire the fundamentals required to support the continued work in diet-related health policies. We look forward to continuing our collaboration with PAHO on a number of exciting pieces that will be done in terms of marketing restrictions, SSB taxes, and of course, my personal favorite, mitigating conflict of interest in public policy making. And I want to take the opportunity to express special appreciation to Fabio and the team that worked directly on the development of the content of the course. It was a journey, it was a process, one through which they persevered, even with all of the comments and the questions that came from us as partners. And I'm just very grateful that we're all here now and are going to be able to benefit from the creation of this course. So thank you all for having joined this webinar this morning.
Thank you very much, Rachel, for your support, for your kind words. We will really appreciate this partnership and hope that this online course could bring more regulatory policies to life and better diets and health for everyone in our region and abroad. I wanted to just touch on a few of the questions that were emerged and then pass over to our unit chief to share her closing remarks. I just wanted to make sure that everyone has the link. So go to the chat if you want to join and register for the course, and you have all the resources and links with the information to join the course and share the course for those that are interested. I wanted also to make it clear that for now the course is only available in English, but the Spanish version is coming up soon. We'll be working on the translation, and we'll let you know when the Stu and a Portuguese version will also follow that one. And once that is completed, we'll come back to everyone and share that with you all. So with that, I thank you all, everyone, and I'll hand over to our unit chief, Dr. Vanessa Garcia Larson, to share her closing remarks. Thank you very much, Vanessa. Over to you.
Thank you, Fabio, and thank you all for joining today's webinar. It's been a real pleasure for me to be here and to learn about the experiences that you are all sharing. I think there is a lot of future in continuing this dialogue around obesity and the regulatory policies to prevent diet-related non-communicable diseases. As you have seen today, throughout this webinar, we have heard how important it is to advance this comprehensive package of regulatory measures to improve food environments and to halt the rise of non-communicable diseases, which are, of course, the leading cause of mortality and morbidity in the region of the Americas. We know that many countries in our region have taken the lead in fighting the obesity epidemic and other diet-related diseases by changing or seeking to change policies, laws, and regulations that reduce the consumption of processed and ultra-processed foods and products in an attempt to reshape food environments in favor of healthier eating. However, as we've heard today, there are several challenges that delay or halt these policies, laws, and regulations from actually being adopted or implemented. And there is, of course, a need to support to overcome technical, legal, and political barriers, as well as industry interference, as it has been mentioned a few times already today. Therefore, it was important for PAHO to develop a capacity building tool that helps fulfill such support towards the development, implementation, and monitoring of effective regulatory measures that can improve food environments and prevent and also manage non-communicable diseases in the region of the Americas. We hope that you have found this course to be available and valuable capacity building tool to support the advancement of these important regulatory measures, including front of package labeling, sugar sweetened beverage taxation, food and beverage marketing restrictions, regulation of food environments in school and in other settings, and the prevention of conflicts of interest. And in doing so, we helped tackle the high rates of obesity and non-communicable diseases across the entire region. So with this, I wish to thank you all for being here, especially to the nutrition team within the Risk Factors and Nutrition Unit who have put a huge amount of effort to organize this webinar, and to all the speakers and panelists who have also been with us today to discuss the course development, design, and how to register for the course, which is going to be pivotal for the future participation of colleagues across the region. I also appreciate your help identifying some of the key capacity challenges that we are facing to advance regulatory measures in the region, and highlight the importance of this course to support key actors to improve food environments and halt obesity and non-communicable diseases associated with high morbidity and mortality. I also want to thank our interpreters and all participants for your thoughtful questions and attention. Thank you very much.
Hallelujah. Are you out? Have you gone?